Welcome to another nursing review on pharmacology. Before we begin, let's see if you can get this question correct. Along with digoxin, amiodarone is also prescribed to a client. What is the nurse supposed to do? 1. No action is necessary. 2. Contact the physician. 3. Encourage the patient to take the medications at the same time. Or 4. Instruct the client to only take a half dose of digoxin or lanoxin. Put your answer in the comment box below. Now back to the lesson. This lesson will focus on antiarrhythmics. We will first learn about the actions of this medication, adverse reactions, and contraindications. Antiarrhythmics are typically used for atrial and ventricular arrhythmias. Different classes have different actions. Now let's discuss how it works. Class 1 medications stabilize neuronal heart membranes by lowering the inward current carried by sodium ions. Class 1A medications stabilize cardiac membranes, extend the action potential, and depress phase 0. Class 1B medications reduce the action potential, stabilize cardiac membranes, and suppress phase 0. Class 1C medications reduce conduction velocity, but not repolarization rate by blocking the movement of sodium ions. Class 2 medications lower blood pressure, heart rate, myocardial contractility, and AV node conduction. Class 4 medications widen coronary arteries and arterioles and reduce myocardial contractility and oxygen demand by blocking calcium ion influx. Okay, now let's move on and learn about adverse reactions. The majority of antiarrhythmics can either create new arrhythmias or exacerbate pre-existing ones. Additionally, they may cause hypotension, hypersensitivity reactions, gastrointestinal issues including nausea, vomiting, or abnormal stool excretion, and central nervous system changes like weariness or disorientation. Heart failure may worsen as a result of certain antiarrhythmics. Bronchoconstriction is a side effect of Class 2 medications. Okay, this is important. Let's now learn about contraindications of this medication group. In patients with cardiogenic shock, digitalis toxicity, and second or third degree heart block, several antiarrhythmics are contraindicated or should be used with caution. Use in pregnant women only if the hazards to the fetus are outweighed by the possible advantages to the mother. Use with caution in nursing mothers because breast milk contains a lot of antiarrhythmics for mothers taking this medication. Children are more likely to experience negative responses, so keep a close eye on them. Use these medications with caution in senior patients, as they may show physiologic changes in the cardiovascular system. Let's now focus on the commonly used medications of this class, starting with amiodarone hydrochloride. Amiodarone hydrochloride is used to treat recurrent hemodynamically unstable ventricular tachycardia or life-threatening recurrent ventricular fibrillation that is not responsive to appropriate dosages of other antiarrhythmics or when other medications are intolerable. The unique mechanism of action of this drug is that it prolongs the length of action potentials by blocking potassium chloride. Side effects are the following. Side effects of the central nervous system include tremor, malaise, and exhaustion. Cardiovascular system including bradycardia, arrhythmias, heart failure, heart block, sinus arrest, and hypotension. Eye, ear, throat, and nose side effects include visual abnormalities and asymptomatic corneal microdeposits. Side effects of the gastrointestinal system include nausea and vomiting. Coagulation abnormalities are hematologic side effects. Hepatic dysfunction and failure are examples of hepatic side effects. Hypothyroidism and hyperthyroidism are metabolic side effects. Acute respiratory distress syndrome and severe pulmonary toxicity are examples of respiratory side effects. Finally, skin side effects include blue-gray skin and photosensitivity. Okay, excellent. Now let's learn about nursing actions for this medication. Only administer medication intravenously if electrophysiologic and continuous ECG monitoring are available. Recognize that there is a significant chance of negative reactions. Obtain the findings of baseline chest X-rays and tests for thyroid, liver, and pulmonary function. Keep a close eye out for pulmonary toxicity. Keep an eye on electrolyte levels, especially potassium and magnesium, and the results of tests for thyroid and liver function. With nursing actions comes patient education. Here are some points to teach the patient. Encourage the patient to wear protective clothes or sunscreen to avoid sun sensitivity. If gastrointestinal reactions happen, advise the patient to take the oral medication with meals. Flecainide acetate. Patients without structural cardiac disease can avoid paroxysmal supraventricular tachycardia by using flecainide acetate, potentially fatal ventricular arrhythmias. By slowing down atrial, AV node, his Purkinje system, and intraventricular conduction, this Class IC antiarrhythmic drug reduces excitability, conduction velocity, and automaticity, while also extending refractory periods in these tissues. Side effects are the following. With the central nervous system, side effects are dizziness, headache, lightheadedness. Cardiovascular system side effects are new or worsened arrhythmias. ENT side effects are blurred vision and other visual disturbances. Gastrointestinal side effects are nausea, constipation, abdominal pain, vomiting, diarrhea. Respiratory side effects are dyspnea. Okay, excellent. Now let's learn about nursing actions for this medication. Make sure that the patient's pacing threshold was evaluated both before and after the initiation of treatment, because flecainide can alter endocardial pacing thresholds. Treat hypokalemia or hyperkalemia prior to flecainide administration, since these electrolyte abnormalities may alter the drug's efficacy. Watch for pro-arrhythmic effects in the rhythm of the EKG. Pay special attention to the flecainide level if the patient has renal or cardiac failure. Therapeutic flecainide concentrations vary from 0.2 to 1 mg/ml. The likelihood of adverse effects rises when the trough blood level exceeds 1 mg/ml. With nursing actions comes patient education. Here are some points to teach the patient. Stress how important it is to take medications exactly as directed. To reduce fluid retention, advise the patient to limit their consumption of fluids and sodium, and to report any negative responses as soon as possible. Lidocaine hydrochloride. Ventricular arrhythmias brought on by MI, cardiac manipulation, or cardiac glycosides are treated with lidocaine hydrochloride. This drug specifically acts as a Class 1B antiarrhythmic, which directly affects the Purkinje network and other tissues to reduce the depolarization, automaticity, and excitability in the ventricles during the diastolic phase. Side effects are the following. With the central nervous system, side effects are confusion, tremor, stupor, restlessness, lightheadedness, seizures, muscle twitching. With the cardiovascular system, side effects hypotension, bradycardia, new or worsened arrhythmias, cardiac arrest. ENT side effects are tinnitus, blurred or double vision. Respiratory side effects are respiratory depression and arrest. Other side effects are anaphylaxis. With nursing actions comes patient education. Here are some points to teach the patient. Infusion recipients need to be monitored by a heart monitor. For accurate infusion administration, use an infusion control device. Monitor the drug level, as 2 to 5 mcg/ml are considered therapeutic values. Also monitor for toxicity in the patient. Seizures may be the initial indication of toxicity in many very sick patients. Notify the prescriber and immediately cease taking the drug if any toxicity symptoms appear. Maintain supplies for cardiac resuscitation and oxygen on hand. Keep an eye on the patient's reaction, paying particular attention to the blood urea nitrogen test, creatinine, blood pressure, and electrolyte values. Stop the infusion and let the prescriber know if the arrhythmias get worse or if the ECG changes. For example, the QRS complex widens or the PR interval significantly lengthens. With nursing actions comes patient education. Here are some points to teach the patient. Remind the patient that toxicity can happen and to report any negative reactions as soon as possible. Procainamide hydrochloride. Procainamide hydrochloride is used for symptomatic premature ventricular contractions and life-threatening ventricular tachycardia that may convert to atrial fibrillation or paroxysmal atrial tachycardia. With a longer refractory period, this medicine specifically reduces excitability, conduction velocity, automaticity, and membrane responsiveness. AV block may be induced by higher than normal dosages. Side effects are the following. With the central nervous system, side effects are fever, seizures, hallucinations, psychosis, confusion, dizziness. Cardiovascular side effects are hypotension, bradycardia, AV block, ventricular fibrillation, ventricular asystole. Gastrointestinal side effects are abdominal pain, nausea, vomiting, anorexia, diarrhea. Skin side effects are maculopapular rash, urticaria, pruritus, flushing. Other side effects include lupus-like syndrome and angioneurotic edema. Okay, excellent. Now let's learn about nursing actions for this medication. ECG should be constantly monitored. Check for overdosage if the QRS widens by more than 25% or if the QTC interval noticeably prolongs. This medication may raise bilirubin, LDH, ALT, AST, and alkaline phosphatase levels. Infusion recipients need to be monitored by a heart monitor. For accurate infusion administration, use an infusion control device. With nursing actions comes patient education. Here are some points to teach the patient. Advise the patient to avoid breaking or crushing extended-release tablets. Propafenone hydrochloride is used to prevent paroxysmal atrial fibrillation or flutter, the suppression of life-threatening ventricular arrhythmias, and paroxysmal supraventricular tachycardia. Also, this drug is also used to extend the period of time until symptomatic atrial fibrillation recurs. In particular, this drug decreases excitability, conduction velocity, and automaticity in cardiac tissue, lengthens the refractory period in the AV node, and lowers inward sodium current in cardiac cells. Side effects are the following. With the central nervous system, side effects are dizziness, anxiety, ataxia, drowsiness, fatigue, headache. With the cardiovascular system, side effects are heart failure, bradycardia, arrhythmias, ventricular tachycardia, premature ventricular contractions, and ventricular fibrillation. With the gastrointestinal system, side effects are nausea, vomiting. Okay, excellent. Now let's learn about nursing actions for this medication. At the beginning of treatment and while adjusting dosage, conduct ongoing heart monitoring. Grapefruit juice has the potential to raise drug levels, so avoid the use of grapefruit. With nursing actions comes patient education. Here are some points to teach the patient. Tell the patient to let the doctor know if they experience any of the following symptoms: persistent diarrhea, sweating, vomiting, or loss of appetite or thirst. These symptoms could indicate an electrolyte imbalance. Advise the patient to avoid opening, chewing, or crushing the extended-release pills. Quinidine gluconate quinidine sulfate is used to treat a number of conditions. Atrial fibrillation or flutter is one. Paroxysmal supraventricular tachycardia is the second. 3. Paroxysmal AV junctional rhythm, premature ventricular and atrial contractions. Additionally, it is utilized to maintain atrial fibrillation or flutter following cardioversion. Because this is a Class IA antiarrhythmic, this drug especially acts on heart tissue through both direct and indirect anticholinergic effects, prolongs the effective refractory period, lowers vagal tone, and decreases automaticity, conduction velocity, and membrane responsiveness. Side effects are the following. With the central nervous system, side effects are vertigo, fever, headache, and lightheadedness. With the cardiovascular system, side effects are ECG changes, tachycardia, PVCs, ventricular tachycardia, atypical ventricular tachycardia, complete AV block, aggravated heart failure. ENT side effects are tinnitus, blurred vision, diplopia, and photophobia. Gastrointestinal side effects are diarrhea, nausea, and vomiting. Hematologic side effects are thrombocytopenia, agranulocytosis, and hemolytic anemia. Hepatic side effects are hepatotoxicity. Respiratory side effects are acute asthmatic attack, respiratory arrest. Other side effects include synconism, angioedema, lupus erythematosus. Okay, excellent. Now let's learn about nursing actions for this medication. Keep in mind that this drug may raise digoxin levels. Keep an eye out for signs of atypical ventricular tachycardia, including torsades de pointe and abnormalities in the ECG, especially a widening of the QRS complex and enlarged QT and PR intervals. Throughout the first 4 to 8 weeks of treatment, keep an eye on the findings of liver function tests. Keep an eye out for quinidine poisoning symptoms such as headache, nausea, dizziness, ringing in the ears, and vision abnormalities. With nursing actions comes patient education. Here are some points to teach the patient. Advise the patient to avoid chewing or crushing extended-release tablets. Advise the patient to stay away from grapefruit juice as it may hinder drug metabolism and delay drug absorption. Let's go back to that question we had in the beginning of the video. Along with digoxin, amiodarone is also prescribed to a client. What is the nurse supposed to do? 1. No action is necessary. 2. Contact the physician. 3. Encourage the patient to take the medications at the same time. Or 4. Instruct the client to only take a half dose of digoxin or lanoxin. The correct answer is 2. Amiodarone, cortisone, and digoxin, lanoxin, taken together can cause increased digoxin levels by as much as 2 times. Digoxin levels must be reduced when given together with amiodarone, cortisone, due to a decreased clearance of the digoxin. Did you get it correct? Alright, well, that ends this video. Pharmacology doesn't need to be hard. Just remember what class the medication is under, and most of the signs and symptoms will be similar, as well as nursing actions and patient teaching. Good luck with your studies. Click here for another nursing video.